Good to hear by and large, in your view, that's the case. But are you preparing, Governor, for a possible surge? And would you be open to revising your decision on a stay at home order in the future?
Well, I don't think there's a reason to do a stay-at-home order. We've done a great job of managing what we were supposed to do, which is about preserving the hospital system. We've got 44% of our hospital beds available, 38% of our ICU beds available, and 78% of our ventilators are available. So we've done what experts told us over 2 months ago to do, which is to make sure we slow the spread of the virus so that we don't have the healthcare system being overwhelmed. And that has been our North Star. That's been our guiding principle.
Hmm.
And now, as we start to loosen restrictions, we're going to continue to do it a step at a time, do it slowly, do it cautiously to make sure we preserve that healthcare system so that anybody who needs that hospital bed, that ICU bed, or that ventilator can get access to it when they need it. So far, we've done that very successfully here in Nebraska, and that's what we're going to continue to do is focus on that as we start loosening restrictions over the course of the summer.
So, when it comes to restrictions, based on your answer right now, is it fair to say the metric you're looking at is hospital bed capacity, ICUs, versus increased number of cases and deaths? Different metrics in terms of your decision making?
Yeah, absolutely. So again, go back 2 months ago. Nobody talked about cases. Nobody talked about deaths. What they talked about was preserving our healthcare system. We built our whole plan around that. And let's take some of the things like cases. That's a variable that changes. As we do more, we're going to expect to find more cases. Your percent positive could change depending on who you're testing and where you're testing. So, for example, early on when we had limited testing capability, we tested people who came into the hospital. Guess what? They tended to test at a higher rate because they were higher risk. They were presenting with symptoms. Well, now that we've expanded that to folks who are healthcare workers, first responders, food processors, also to people who are 65 or older, we're testing more people who are not necessarily or who are symptomatic. Maybe they're asymptomatic, and so our percent positive rate is dropping. So, but we've also greatly expanded the number of cases, so we are getting more
Hmm.
cases tested positive. It seems kind of natural. So that's not that variable changes. So it's not a really good one to look at. But hospitals, people go to the hospital when they feel sick. It doesn't matter if they test positive or negative for coronavirus. If they feel like they need to go, they're going to go. Really what you're trying to do is find a variable you want to look at to make sure that it's something that's not going to change. And that's what and really this is what it's all about is making sure we can provide that care. Again, over 2 months ago, all of our public health experts said, nobody's got immunity to this virus. You can't stop it from coming, but you can slow it down to make sure that that peak does not overwhelm your healthcare system. That's what we've done here in Nebraska, and that's what we're going to continue to do.